Well, according to the January 12th, 2015 Journal of the American College of Nutrition, 40% of Americans are undernourished when it comes to vitamin A, D, E, and K, B2, B6, calcium, magnesium, the basic things that medical doctors know about. 40% of Americans are deficient in these nutrients, and that the minimum daily requirements, as found in most vitamin mineral supplements, have failed us miserably. What they're talking about is that the minimum daily requirements, 100% of the minimum daily requirements, were really designed by a variety of means. Really not much science involved, and sort of hip pocket stuff and on the back of the envelope. And it turns out that it's barely enough for some people, not all the people, but it's barely enough for some people just to sort of stay alive. Certainly not enough for everybody to flourish. What they're talking about is what we really need is 2,500 times the minimum daily requirement. We need 2,500 times the minimum daily requirement. Now, that's pretty significant. We're not talking about double the amount. We're talking about 2,500 times the minimum daily requirement. And, of course, this is what we've been talking about with the 90 for Life program. When you look at the nutrient levels in these things, there's many of the really critical ones that are, drop dead critical, like you can't live a few minutes without them. They're literally hundreds, in some cases thousands, of times the minimum daily requirement. That's why we have such interesting results in the 90 for Life program. Well, what I want you to do is get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. And when you look at the various diseases, when you look at the various nutrients, we give you the suggested daily intakes. And, of course, you can see they far, far exceed the minimum daily requirements. Well, there's diseases that when I deal with them, things like, let's take a diagnosis of Alzheimer's disease. Doctors, first of all, want you to believe that Alzheimer's disease is genetically transmitted. It's certainly not. And they say if you do 7 things, if you acquire 7 habits, you can reduce your risk of getting Alzheimer's disease. Now, the first thing on their list of things to do, habits you want to culture to avoid Alzheimer's disease, and remember, they're saying it's a genetic disease, is to read a book every month. You tell me how reading a book every month is going to reduce your risk of a genetic disease like Alzheimer's disease. Well, Alzheimer's disease is a simple nutritional deficiency disease, and it was created by doctors. It's a physician-created disease, and this is why you want to read the book Epigenetics. It'll put you on the right rails, keep you there, tell you what to do, how to prevent these diseases, and how to reverse them. This study was published in 2004, and it showed that people getting the supplement program were 80% less likely to have Alzheimer's disease than those who didn't. In other words, for every 100 that the control group got Alzheimer's disease, only 23 of the ones getting the supplement group got Alzheimer's disease. So you reduce your risk of Alzheimer's disease by 78% by taking a supplement. This is crazy if it's a genetic disease, right? It can't be a genetic disease. So I urge you to really think in terms of you're not going to be able to eat well and get your nutrients, right? Why would you throw away your life and the life and the health of your kids on the throw of a dice on what may or may not be in the food you're eating? In the animals, we give them everything we know they need to maximize their genetic potential for longevity and for health and fending off disease and strength and speed and intelligence. Why do we just think we humans can just eat well and get everything we need? It's an insane, silly, stupid concept. So I urge you to get the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, learn what the true needs are each day, and see if you think you can get everything you need just by eating well. Let's see, a guy by the name of Steve Jobs tried it, and he died at 56. And he's a very clever guy, a billionaire, probably one of the smarter individuals when it comes to measuring IQ and that kind of stuff. And yet he died at 56 because he chose poorly. He became a unsupplemented vegan. Now, you can be a very successful vegan, but you're going to have to supplement with the 90 for Life program, really seriously and heavily. And so you're going to have to be obsessive about this. This is not something you can just sort of do, okay? And if you're not prepared to do this obsessively, you're not going to maximize your genetic potential. You must do this, like obsessively, day and night, 24/7, while you're sleeping, while you're awake, while you're eating, while you're preparing food, how you cook your food. This is all important. I'm not prepared to give up 100 years just because I'm lazy, okay? I'm not going to be lazy. I'm going to be obsessive. And the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, tells you how to do this. Everybody can do this in their homes. Also, if you want to maximize your genetic potential for longevity and give your genes, your DNA, RNA, and your telomeres everything they need to maximize your genetic potential for longevity and health, depending on disease, I want you to also get, in addition to the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, get a hold of the book, Immortality, and get a hold of the book, Rare Earths and Cures. And between those three books, they look at the top 20 longevity cultures on Earth and show very clearly why. They show very clearly why these top 20 longevity cultures have 40 times 100-year-olds we Americans do. They have 100-year-old per 250 of their population. We have 100-year-old per 10,000. Certainly it has nothing to do with medical care because none of them have any medical care. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, this one actually kind of surprised me because it had some things that it got right, and of course they got part of it wrong too. They say 6 habits to improve healing surgery. This is a CNN story, and they say this is all these 6 things come from a Dr. Jamal M. Bullock, a surgeon from the Kelsey-Seybold Clinic in Houston. Is giving advice. If you do need surgery, they say successful surgery depends on a number of factors. A few that you can control yourself. Even minor surgery may pose some risk that has long-term implications. They say here's 6 habits you need to commit to right now to help your body heal. And the first one is quitting smoking. They say a habit can cause irreparable damage to your organs, increases chances of heart attack and stroke, can significantly hamper your success of a procedure. While in surgery, the damage from smoking to your airway and lungs, it makes it more difficult to control your breathing under anesthesia. Additionally, smoking damages your vascular system, which can bring to complications to wound healing. The next is improve your diet. Say poor eating habits can negatively affect how your body reacts to surgery. Malnutrition can weaken your immune system, cause muscle weakness, and decrease cardiac and respiratory function, and may negatively affect wound healing. Consider supplements. This is the one that really shocked me that they even talked about supplements. They say even if you eat a well-balanced diet, it may still be lacking some important vitamins and protein that promote healing. Supplement vitamins such as A, E, and C, and protein can promote acute healing. Of course, not one mention of minerals or the other 13 vitamins that your body needs. And they go on to say manage your weight. They say being overweight and obese increases your risk because it increases your risk factors for cardiovascular disease and respiratory abnormalities, heart failure, hypertension, pulmonary embolism, and deep vein thrombosis. They say if you're overweight or obese and considering a non-urgent surgery, you should try to lose some weight first. Then the next one is manage chronic diseases like diabetes, kidney disease, and hypertension. They say that it may increase the chances of complications during surgery, and it's important to be in the best condition before surgery. And they say follow your doctor's orders. They say surgery is a team effort and is imperative you do your part to eliminate potential problems. Follow your surgeon's instructions before surgery and ask questions if something is confusing. So they got a few things right, but they left out big important things like 13 other vitamins and 60 minerals and amino acids and essential fatty acids, and, all of which would help promote healing. And I think they should add a 7th one, and that is get a second opinion and see if you even need surgery in the first place. Well said.
And, of course, that's why we came up with the book, Let's Play Doctor, so people could, if nothing else, they could kind of look up the disease and see what their options are. And you can do your own laboratory test. Go to the pharmacy without a prescription and get the same test strips your doctor will use in his office. He'll charge you $2,000 for a physical. You get the same test strips for $1.50 each. So if you do everything, urine, blood, colonoscopic exam equivalent, it'll cost you $4.50 instead of $2,000. You'll get the same information, and, of course, it'll be safer because you're not likely to kill yourself. This is crazy. And so get that book, Let's Play Doctor, and learn how to deal with these things yourself. Do it on an annual basis. That's what I say, Doug. When families get together, like Christmas, 4th of July, Easter, Thanksgiving, anytime they get together, some big graduation, wedding, anniversary, big events, everybody should be doing their physicals. Keep a log book for the entire family. It doesn't take long, once or twice. all the little kids and grandkids and great-grandkids, they're all bringing your little cups of urine, and they're saying, I want to do my physical. Because they're very clever. They like to see those color changes on the test strips and everything. Get everybody involved, and you'll add 30, 40, 50, 75, 100 years to everybody's life. Thank you, Doug. Super job. And we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
All right, let's head to Alaska. And Estrolita, you're on with Dr. Wallach.
Yes, hello. Estrolita, you're on the air.
Hi, Dr. Wallach. I'm excited to get to talk to you since I heard you first on Coast to Coast FM a week ago.
Yeah.
And since then, I've been researching on YouTube at different interviews that you've had.
Yeah, George Norrie's a lot of fun. Thank you so much.
It makes a lot of sense to me, many things that you say, and I'm looking for solutions. I have so many, I don't really know how to tell you what's the most important one. I am taking currently hormone replacement therapy and thyroid supplement. I have a complete hysterectomy. 2 years ago, I started developing tremors in one leg, but now I'd say my whole body has tremors. Nobody seems to know what they are. I have MRI that shows a bright spot that somebody is beginning to say is multiple sclerosis. I also have had, a depreciation in my connective tissue. I have a frozen shoulder now, and I've already talked to a surgeon. Another doctor wants to do prolotherapy. I'm not used to going to allopathic doctors. I tend to be conservative myself, and I see the value and the merit in what you're saying, but I don't even know where to start.
Let me ask you a couple of questions. Thank you. I kind of get the drill here. How much do you weigh?
I weigh about 135.
Okay. And how old are you?
56.
Okay. Now, do you have any other issues, any known diseases other than the thyroid stuff, and you've had a hysterectomy? Do you have anything like diabetes or arthritis or high blood pressure?
No.
Okay.
They started to see some, what do they call them, osteophytes, or the beginning stages of
bone spurs?
arthritis.
Mm-hmm.
Yeah.
Okay. Okay. What about any history of skin problems? Any eczema, dermatitis, psoriasis in yourself or your kids?
One of my sons has eczema.
Okay.
Him as a child.
Sure. Any belly problems in you or any of your kids? Constipation, diarrhea, bloating, irritable bowel syndrome, colitis, anything like that?
I have bloating, and I have issues with foods. Like when I was a child, I stopped drinking pop because of the way it made me feel. Mm-hmm. But I don't know what that's related to.
Sure.
I don't have
it could have been a sugar
diet.
problem. Okay. Shar, what's going on here?
She's got a gluten intolerance for sure.
Yep. Yeah. Anytime you have this many things and you get the greatest doctors on earth can't figure it out, you got a gluten problem. Well, hang on here, Elistro, and we'll be back with you, Elistrolita, and we will be back with you, and we'll give you a program after these messages. Okay. Douglas, right back to Alaska and Estrolita. All right. So, Shar?
Yes?
Okay, we have a 135-pound lady who has thyroid issues. She has probably the beginnings of MS, which may be reflected in these whole-body tremors she's talking about. She's got connective tissue problems, maybe things like fibromyalgia, lupus, but she has shoulder and arthritis, things beginning. She has digestive problems, and she has hormone issues because she's had a hysterectomy. Where would you start with this gal?
Okay. Oh, boy. Okay. I would start with a healthy brain and heart pack for sure. I would add the Ocean's Gold,
right.
And I would also add the Women's FX for the female problems.
Okay, what would you do?
And I would add the glucogel for the joint problems.
Okay. And what would you do for the bloating?
Oh, she needs to get the enzymes, and she also needs to get on a gluten-free diet.
Well, there you go. Perfect. Okay, so Estrolita, as Shar said, you need to get rid of all the inflammatory foods, particularly gluten, no wheat, barley, rye, or oats in any form. We actually have a CD called Serial Killers that show all the hidden places you're going to find gluten. And then you want to give up all the fried foods, the processed meats, the oils, and gluten. Then, as she says, 135 pounds, I go ahead with one Healthy Brain and Heart Pack, and I'd get an extra bottle of selenium so you can have 3 selenium twice a day. I'd get an extra bottle of OsteoFX Plus so you could have 1 ounce at breakfast and 1 ounce at dinner. You can go ahead and have 1 scoop of the Beyond Tangerine NutriCrystals 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast, and 3 of the EFAs at dinner. All that would be accomplished by the 1 Healthy Brain and Heart Pack plus the extra bottle of selenium. And then, as she said, I'd also get 2 bottles of the glucogel, so you could take 15 of those a day, 5 at breakfast, lunch, and dinner. That's for the arthritis in your knees and shoulders and early bone spurs. Get a hold of the Ocean's Gold. She's correct there. For the thyroid, 3 twice a day. 3 of those tablets twice a day. That's 2 bottles a month to support healthy thyroid function. And let's see here. For the bloating and digestive problems, I would go with the, let's see here. I would go with the Ultimate Enzymes. Take 1 or 2 of those, 2 minutes before each meal, with a couple ounces of water. And then for the MS stuff, what natural food would you throw in there every day, Shar, to support the rebuilding and maintenance and repair of that myelin in the brain that's damaged when you have MS?
Lots of eggs.
Lots of eggs, 6 to 8 eggs a day, poached, soft, yolk, soft boiled with soft yolk, soft scrambled in butter. And then call us every couple of weeks. Give us a progress report or lack of progress report, and we're going to walk you through this because we think that these are the sort, we see these kind of combinations thousands of times a month, and guess what? Most of them are easily resolved. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
Let's head to Orlando, Florida, and Dawn, you're on with Dr. Wallach.
Hello, Dawn, you're on the air.
Hi, Dr. Wallach. Long time no talk.
Yes, sir. What's up?
I've called you for a long time. Diabetes.
Type 2 or type 1?
Type 2, excuse me.
Type 2. Okay. Is this in yourself or somebody else?
Oh, it's me.
Okay. How much do you weigh?
215.
Okay. And how old are you, sir?
71.
All right. Do you have any other issues, any arthritis, high blood pressure?
High blood pressure and leaky pee-pee, if you know what I mean.
Okay. So you have some incontinence problems?
Right.
Okay. Do you have any back problems?
No.
Okay. All right. Yeah, it could be a prostate problem, could be a back problem. There's several things that can cause urine dribbling and leaking and unable to empty the bladder and urgency and all that kind of stuff. Some doctors call it irritable bladder syndrome. It could be prostate problem in men, or a combination of both. All of which is caused by a back problem. And let's see here, weighing 215 pounds. Do you have any history of any skin problems, any eczema, dermatitis, or psoriasis?
Not really.
Okay,
no.
Good. Any history of respiratory stuff, chronic bronchitis, asthma, anything?
No.
Okay, good. All right, this sounds pretty straightforward. Char, what would you do here?
Well, if he's got diabetes, he needs at least two of the healthy blood sugar packs.
Okay, what would you do for the high blood pressure?
I get Ultimate daily.
Okay, and what would you do for the urinary problem, which could be a prostate thing or could be a back thing?
If it's a back thing, he needs glucogel.
Okay, and what for the prostate?
ProstFX.
Well, there you go. Okay, so Don, what I would do here is, as Shar said, get yourself 2 of the healthy blood sugar packs per month. That'll allow you to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses twice a day, and then 3 of the Sweeties twice a day. All that be accomplished by the 2 healthy blood sugar packs. Take your fasting blood sugar every morning before you medicate yourself and adjust your medication, be it pills or injections, based on your blood sugar levels. And then for the high blood pressure, as Shar said, I would go ahead and take 1 bottle a month of the Ultimate Daily tablets. It'll allow you to have 3 of those tablets at breakfast and 3 at dinner. They're designed to support and promote healthy blood pressure and support healthy blood flow through obstructed arteries. And then for the urinary problem, 3 of the ProstFX twice a day. That's 2 bottles a month, and they're designed to support healthy prostate function and size. And then, because this is a possibility, it's a back problem, I would also take 2 bottles a month of glucogel, so you could take 15 of those a day, 5 at breakfast, lunch, and dinner. The goal here is to support and promote maintenance repair of the disc between the vertebrae, make them thicker, so they can push the vertebrae apart, take the pressure off the roots of the spinal nerves that actually control the bladder. Give us a call every couple of weeks and give us a report. We want to know, obviously, your weight. We want to know your blood sugar levels. We want to know how your blood pressure is and so on, and let us know how your urinary system is going. Okay, Doug, we have time to start another one?
We certainly do. Let's head to Ontario, Canada. And Joanne, you're on with Dr. Wallach.
Oh, Joanne, you're on the air.
Hi, Dr. Wallach.
Yes, ma'am. What's up?
I'm 47 years old, and I survived a fire to 60% of my body 13 years ago with a 5% chance to live. I talked to you a couple of years ago, and since then I've gained 50 pounds. I was already overweight. I'm on Beyond Tangy Tangerine and calcium, magnesium, vitamin D supplement, 1 scoop twice daily of the Tangy Tangerine, 1 scoop of the calcium, magnesium, vitamin D powder. I'm also on other supplements. I have a gallbladder issue. I have a big stone blocking the bile duct, and I have stomach acid bathing my vocal cords on a regular basis. I have to go.
Wait a minute. Do you have jaundice? Do you have jaundice? Are the whites of your eyes yellow?
No. But,
okay, so it's not a complete obstruction.
Last week, 2 weeks ago, when I had an attack, gallbladder attack, he told me that I should get it removed before it ruptures.
How much do you weigh?
My brother has told me that you don't really recommend that.
Yeah, how much do you weigh?
Gluten intolerance that.
How much do you weigh, Joanne?
I do have schizoaffective disorder as well with anxiety attacks, which I suffer from on a weekly basis, a few times a week. And I'm on medication for that. I'm on ziprasidone. I have to eat 600 calories per meal for that medication to work effectively. My children also have...
Okay, how much do you weigh?
I weigh 250 pounds. I'm 5'9".
Okay. Yeah, 5'9". I'd like to see you weigh 165, 170, so we need to lose about 80 pounds. Okay, let's see here, Shar. Yeah, we have liver problems here because the gallbladder is kind of innocent. The gallstones are actually caused by liver problems. Schizophrenia, of course, is a chemical imbalance of the brain because of nutritional deficiencies. She has a history of fire burns, serious burns in over 40% of her skin area. And she has a gluten intolerance, we know, and she's 80 pounds overweight. Where would you go with that one?
Okay, well, she needs at least 2 and maybe 3 if she can afford it. Healthy brain and heart pack.
Okay.
And she needs to get on a gluten-free diet, of course. And
what would you do for brain metabolism?
For brain metabolism?
How about de-stress?
Yeah, that's what de-stress, that's what I was going to say.
Okay,
de-stress,
good.
yes.
And what would you do for the gallbladder?
Enzymes.
Okay, very good. All right. Okay, here we go. And what would you do for her need to lose 80 pounds?
ASAP.
There you go. Perfect. Okay, Joanne, you need 2 healthy brain and heart packs. That would allow you to have, and I also get a bottle of this selenium, an extra bottle of selenium, and that'll accomplish what Char wants you to have. I want you to have 9 of the selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner, and all that will be accomplished by the 2 healthy brain and heart packs plus an extra bottle of selenium. You need 9 of the de-stress capsules a day. That'll be 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 3 bottles a month, and that's for particularly the metabolism of the brain. And for the gallbladder, 2 of the ultimate enzymes 2 to 5 minutes before each meal with a couple ounces of water. We call that the gallbladder in a bottle. Let's see what that does for you here. And then also, let's see here, we need to have you take the ASAP. And the ASAP, I'd get 2 bottles a month of that, so you can take a full dropper full, not a drop, but a full dropper full of the ASAP 30 minutes before each meal, and a second dropper full 15 minutes before each meal. So you're going to have 2 droppers full before each meal, one 30 minutes before the meal, and the second one 15 minutes before the meal. And leave it absorbed through your oral tissue. Do not swallow. It won't hurt you if you swallow it, but you're not going to get the maximum benefit. And usually within 3 to 5 days, you're going to begin to get a half a pound to 2 pounds a day weight loss. And the magic here is when you get down to where you want to be, you'll never gain the weight back as long as you're staying on the 90 for Life program. Give us a call every couple of weeks and let us know your weight and let us know how your emotional stuff is going, how your digestive stuff is going, what your weight is, and so on. And we'll go from there. We'll be back with Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity 95 Crusade. And Doug, let's go to Wisconsin. And Donna. Donna, you're on the air.
Hi, Dr. Wallach.
Hi. How can we help you?
I have bleeding hemorrhoids, and I started taking Youngevity liquid supplements 1 month ago. Will the bleeding eventually stop?
Okay. How long have you had hemorrhoids?
Oh, quite a while. I don't know how many.
Years?
Yes.
Okay. All right. Do you have a tendency to be constipated?
No, I don't. I don't eat a lot of junk food, so I don't.
Okay. Do you have the other way? Do you have diarrhea, or do you have a couple of regular bowel movements each day?
Yes.
Okay. Which one?
The latter.
Okay. Okay. All right. And let's see. Do you have a history of any skin problems, any eczema, dermatitis, psoriasis?
Well, my face breaks out still, and I'm 62 years old.
Okay, so it might be rosacea. And did you have asthma as a kid?
No.
Do you have any children?
No.
Okay. Do you have any brothers and sisters?
Yes.
Okay, do they have any kids?
Yes.
Okay, do they or any of their kids have any asthma that you know of, or eczema, dermatitis, or...
No, not that I know of.
Okay. All right. Well, the fact that you have some rosacea on your face, you have a history of bleeding hemorrhoids and maybe some diarrhea once in a while, maybe some constipation once in a while. What would you do for this young lady, Shar?
Well, I would have her probably get on a gluten-free diet, but also she could take the rainforest at night. That might help.
And what do you weigh, Donna?
125.
Yeah. Yeah, you could take a tablespoon, which is a half ounce of our herbal rainforest at bedtime. It's a great colon cleanser. But what would you do for her hemorrhoids, which are hemorrhoids are just varicose veins in a funny place? What would you do for her hemorrhoids, Shar?
With the copper, so she needs selenium for the...
Very good. Yep. Hemorrhoids are just, as I say, varicose veins in a funny place. And so it would not be unusual for you also to have varicose veins in your legs, spider veins. Do you have any white, gray, or silver hair, Donna?
Yes.
Yeah, so that's also caused by copper deficiency. It all kind of goes together. Very good, Shar. And so what I would do, at 125 pounds, as Shar says, I would have you take one healthy brain and heart pack per month. One healthy brain and heart pack per month. Get an extra bottle of selenium, so you could take 3 selenium at breakfast, 3 at dinner. And as far as the copper that comes along there is a cofactor for the selenium. And you'll actually see an increase in return of color of your hair. It's not unusual. And it wouldn't hurt. Obviously, if you have some really serious bleeding, and I've seen some serious bleeding with internal hemorrhoids, you can wear Depends and wear a pad like you'd be having a period. You could go ahead and wear pads and get the Depends so you don't soil your clothes with blood and all that kind of stuff. Or if you're just dripping a drop of blood here and there, that's not quite as egregious. But, because you have the rosacea, you want to get on a gluten-free diet, no wheat, brown, and oats, no fried foods, no processed meats, no oils, and have you eat things like eggs. And let's see here. Let's start there, and give us a call every couple of weeks, and we'll begin to walk you through this. But don't forget that herbal rainforest, a tablespoon. So that 1 quart is going to last you 2 months, because you take a tablespoon, which is a half ounce at bedtime with a glass of water, and that'll soften your stool. And even a normal bowel movement might be too firm for somebody who has very sensitive, thin-walled hemorrhoids, and cause them to kind of scratch them. And when they have passing a bowel movement, you might cause them to bleed a little bit. It's not unusual. Okay, very common. Sometimes you get fissures where you have cracks in the anal sphincter and so forth, and this all will heal. Are you taking any aspirin or anything like that, Aleve?
No.
Okay,
no.
Good. Because sometimes that can contribute to the bleeding from hemorrhoids if you have those types of painkillers. So, you don't want to take those. All righty? Give us a call every couple of weeks, if you would, Donna, and we'll walk you through this, okay?
Okay, thanks so much.
You're very, very welcome. Well, thank you, Shar. Super job as usual. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.